Thanks for staying with us on The Real Story. Connecticut is seeing COVID cases spike right now. We know it's mostly, if not all, from the Delta variant, which quickly took over. We are seeing hospitalizations, though, increase, which is alarming and concerning. But the Omicron variant is also throwing another wrinkle in our road out of the pandemic. It was first found in South Africa, and it is now in the United States. So we want to bring back Dr. Albert Coe. He is a professor and chair of the Department of Epidemiology and Microbial Diseases at the Yale School of Public Health. Welcome back on The Real Story.
Thank you very much, Jen.
Okay, so let's talk about Omicron right now. We know it's in the United States. We knew it was going to come here, and it is a little bit early, right? I think it was some 2 weeks they were saying scientists needed to understand if it was more transmissible or if the symptoms were more severe, for example, with this COVID variant. But what are you hearing at this point?
So a couple things, and of course, as you know, Jen, just today, cases have been identified in New York City. So certainly this kind of is a story that we've seen repeated throughout the pandemic with the variants and also with the initial spread of COVID virus, that because people can become infected and not show any symptoms, it makes it very difficult to kind of pick up the infections, before they travel long distances. And we live in a highly interconnected world. So we're, as we've seen with the Alpha variant that came out of England, as we also seen with the, Delta variant that came out of India, that, by the time we detect it, it's pretty much spread to many of the countries. And because of the high transmissibility of COVID in general, I'm pretty sure that, we're going to be, if we don't have cases now, we're going to be seeing them in the next several weeks.
So from early data, does it look like it's more transmissible? I mean, I know so far from the very few cases that we've heard about in the United States, we're hearing that, I think 2 people were vaccinated. One of them had their booster, the other one hadn't, and that they were showing mild symptoms. But certainly we can't draw a conclusion from 2 or 3 cases that we're seeing in the United States yet.
Yeah, so as you say that, we're going to be learning a lot in the next several weeks about this virus and what we need to do and what we don't need to do. Just as an aside, we've had many variants arise throughout the pandemic. Some of them come up and they burn out. Some of them go on, like the Delta variant, to become in of themselves cause a global epidemic. What we know about the Omicron variant that's come out of South Africa, first of all, is that it contains mutations that make us concerned that it's highly transmissible. And these are mutations that are also shared with other variants that are highly transmissible. The second, is that it has a large number of mutations in a very key protein of this virus, the protein that actually interacts with our host cells. And that raises a couple questions. One is it more virulent? And the other, does it escape the vaccine and the immunity, provided by the vaccine? So those are questions that we don't have answers for. And it will take weeks, if not months, to really get definitive answers. We are worried and concerned because there's a number of mutations that are happening. There are a couple things. One, with respect to transmissibility, certainly the epidemic that's happening in South Africa makes us concerned that this is highly transmissible. It's going to take us a while to understand whether it really does cause more severe disease, or it could also cause less severe disease, as the current viruses, including the Delta variant, which is the dominant variant here in Connecticut. And then in terms of escaping the immune responses or the protection, conferred by vaccines, it's kind of expected that we'll see cases in vaccinated people. We know that our current Delta variant and other variants of the coronavirus can cause infections in people in vaccinated individuals, the so-called vaccine breakthroughs. But the good thing that what we've known from these other variants is that the vaccines, even though they're not 100% protective against being infected or becoming mildly ill, they do protect against severe disease and hospitalizations. So that's what we're, from based on what we know and extrapolate, that's something that we do hope for. It will be the case with the Omicron, right? So that vaccines will still save lives. And that really underscores the importance of people going out and getting vaccinated. That's how we're going to address not only the threat of Omicron, but also the current surge that we're experiencing here in Connecticut.
Yeah, I know. The current surge is alarming. I know the positivity rate, and you and I have talked about this on the program before, can be somewhat misleading, right, to just look at the positivity rate, because it depends on how many people get tested, how many of those tests become positive. Lately, though, on Thursday, the positivity rate was upwards of 6% plus. So you really got to look at the 7-day average, but it's really hospitalizations that are starting to be concerning, because we have over 400 people in the hospital right now. And, that's a jump from the 220 or something that we had on average just a couple of weeks ago. And the state did put out information that 80% of the people who are in hospitals right now are unvaccinated. So it does show that unvaccinated is the majority of those cases that are in hospitals right now.
Yeah, no, those are really telling statistics, and they really guide us, Jen, on what we need to do to protect ourselves. I think without invoking Omicron, we are concerned about really, the current variant, the Delta variant, and repeating what we experienced last year. We're getting into the cold weather. People are spending more times indoors. We're having in the holiday seasons gatherings such as Thanksgiving and upcoming holidays at the end of the year. And so without having to invoke, a new variant, we are in a period, we are undergoing a surge. Whether it's because of test positivity or whether it's the number of cases, we are having increased transmission, and we're undergoing a wave that's actually bigger than what we experienced here in Connecticut during the Delta variant. So I'm particularly concerned about that. And again, it goes back to really the kind of the meat and potatoes of what we know how to protect ourselves, our family, our loved ones, or our community, and that's getting vaccinated. People who aren't vaccinated, getting vaccinated, getting our children who are now eligible to getting vaccinated, getting them vaccinated, getting people, especially the elderly, but all ages, getting a booster. If you've been vaccinated, completed vaccination more than 6 months ago. Mm-hmm. And then when you're going indoors, wearing masks. Those are the things that we know work. And during a surge, those are best practices.
Even if you're vaccinated, right? You're recommending, if you're walking into a store, put your mask on at this point, just right, because of the numbers. Kids getting vaccinated. We know ages 5 to 11 can now access the vaccine. Will that put us close to herd immunity at some point if kids go and get those vaccines? Herd immunity is a whole other discussion that I do want to have, but does that get us to a point where maybe kids could at some point not have to wear masks in schools, et cetera?
Well, so first of all, we need to protect children. And these vaccines, from the information that we have now, that was used to approve these vaccines under the emergency use authorization by the FDA, that these vaccines are safe. We have the highest incidence of cases are among our school-age children. And so getting them vaccinated to protect them is certainly the first priority. The second reason we want to do that is because children live in homes. Many times they live in multi-generational homes where they're living with their grandparents. And we need to protect not only the people who are elderly, the people with underlying medical conditions who are susceptible to the severe, complications of COVID, but also in the community. And the good way to doing that is vaccinating those people who have not been vaccinated, which specifically are our children. But bottom line, there's not going to be a magic number that we reach that's going to protect us unfortunately, from COVID. Not like measles, where if we can vaccinate 97 or 98% of the population will hit that magic part where we can, where transmission stops. And that's because the vaccines are not 100% effective against being infected with the SARS-CoV-2 virus. And as long as a vaccinated person can get infected and pass that on to somebody who's either vaccinated or unvaccinated, there's not going to be that magic number where everything will stop and we can just go back to normal, unfortunately, at this moment.
And so I know we used the term herd immunity way earlier on. I think that was even before we knew about whether a vaccine would be developed. Well, actually, no, I think it was during when we had the vaccine developed, but we didn't know the efficacy at that point, right? And so we were hoping to achieve herd immunity. Then we started seeing some breakthrough cases and the efficacy wasn't 100%. So is herd immunity kind of thrown out at this point?
I think so. I think it's probably, I think the more important question is what does the vaccine provide us and how does it protect us? It protects us from getting severe complications, from getting hospitalized and from dying from the disease. And even with the 2 doses, but now with the booster, that protection is very high. It's over like 90%, certainly for the Moderna and the Pfizer vaccines. It also protects us from getting ill. It's not the 100%. It's probably, if you've gotten vaccinated 6 months ago, it may go down from the 95% in the early days down to the, to maybe 60, 70% protection. It does reduce our ability, if I'm vaccinated and I get infected, of my risk of transmitting it to another person. So even though we can't hit that magic herd immunity number, it's still going to protect our loved ones, our communities, and the citizens of Connecticut. So those are all the kind of the scientific and public health reasons for really the Department of Public Health encouraging people to go out and get vaccinated.
Right. You hear people say, well, I'm vaccinated, but I'm still getting it, so what's the point? But it is important to note that your viral load is a lot less, so you're spreading it to a lot less people, right? And that also creates you having less, more mild symptoms as well, I would assume.
Yeah, that's certainly true.
Yeah. Okay. Dr. Albert Ko, always good to hear from you, and we'll continue to keep having you on this program periodically to give us an in-depth analysis on what's going on with COVID. Thank you so much for your time.
Thank you very much, Jen. Take care.
All right, that does it for us on The Real Story. If you want to watch these segments again, head to fox61.com or download the Fox 61 app and watch The Real Story every Sunday at 10 a.m. right here on Fox 61. Have a great morning.